Good afternoon, everyone. I think it's already 3, so I think it's better if I start. You can hear me, right? Emma? You can hear me, right? I just want to make sure if you can hear my audio.
Yes.
Okay, thank you. So I hope how many of you have attended any of the previous data analysis webinars? Please inbox me. I want to know if you have a prior understanding of what we're about to talk today, or if data analysis is in general new for you. So this is the third part of data analysis from our webinar series. So have you ever attended any of like either part 1 or part 2, especially part 1 of the webinar? Great, part 2 is also fine. Okay, so for those of you who did not attend the previous 2 parts, you can access the videos from the EMA website. They can drop you the link to the video, so you can go back and refer. So today we're going to cover part 3 of data analysis. Actually, I'm going to go through the first 2 parts just as a summary, so you'll be able to catch up later. So what we're doing here is we're trying to understand research in healthcare systems so that we can conduct research independently. So research is a systematic collection, analysis, and interpretation of a data to answer a certain question or solve a problem. So research has basically this flow. It starts from a research question and ends up with an interpretation of the result from the research that we conducted to answer the research question or the problem, and then finally apply this result into practice so that we can improve the healthcare system. So in this process, data analysis is one of the very important parts, which bridges our question and interpretation of the result and its application. So data analysis is a very important part, and this is how we define it. This is a systematic process. We apply our statistical knowledge and our scientific knowledge to our managed data so that we can answer our research question. So the thing is, when we do data analysis, what we need is not just our statistical knowledge, but we also have to apply logic or our scientific knowledge to our managed data so that our result can have a clinical meaning as well, in addition to just the statistical meanings. So simply data analysis means making a meaning out of a raw data. So we start with a research question, and then we collect data to answer that question. Before analyzing it, there's a process called data management. This is a very critical part. We have covered this in 2 webinars. You can also access these videos on the EMA website. So after managing our data and preparing it to be fit for analysis, we do our analysis. By doing our analysis, we answer our research question. So how do we make a meaning out of our raw data? So there are different levels or steps of data analysis. We have seen this last time. So the first one is describing our data. After we collect our raw data, we start with description of the data. That means we characterize our study population based on all the studied variables, like based on the exposure and the outcome of interest. We characterize our study population, and this is a very important part that should be presented in every research, whether qualitative or quantitative. We should start our result section by describing our study population so that our audience can have an understanding of what kind of population was studied and whether it is representative of the larger population, our target population, that we eventually want to make generalization about. So it's a very important part of our data analysis, yet it's easy to conduct. So we have covered that in our last webinar. To describe our data, we use descriptive statistical tools. you can go back and refer. So today we're going to see the comparing groups part, but roughly I'm going to go through all the layers of data analysis so that you can catch up. Comparing groups is our second interest. It means we can do a comparison of the characteristics of the study population based on either their outcome status or some exposure of interest, to see if there is similarity or difference between the groups. It's not a common trend to conduct a comparative analysis unless our study design is a comparative in nature, like comparative cross-sectional design, case control, cohort, or experimental designs. Unless we have comparative study design, it's not a common trend to conduct comparative analysis. So that means simply in a cross-sectional study design, we don't do comparative analysis unless we have a special interest. It's not mandatory. You can also go back and refer to the study design webinar. So in this case, we use inferential statistical analysis tools or comparative analysis. And the third one is, which in most cases, our ultimate goal of doing research is identifying factors that could possibly affect our outcome. So we're interested more in a cause-effect relationship when we conduct a study. So this is what we call building a relationship. In this case, our interest is to identify a significant exposure that could possibly affect our outcome, so that if we know the causative factors or the risk factors for a patient or our participant to develop the outcome, we can provide a preventive or curative services. So in this case, building relationships or analytic analysis is performed only in analytic research designs where there is an interest of building relationship between groups. So, and to conduct that, we use inferential statistical analysis methods or simply regression analysis. In our next webinar, we'll cover this. But today we're going to see the comparing groups part. So when we compare groups, what we do is simply we compare the characteristics of the study population based on their outcome of interest by classifying them as those population with the outcome and those population without the outcome. Or it could be based on their exposure status, like based on whether the population group is exposed or not exposed. So based on the study design, we can compare groups based on their outcome or exposure status so that we can see if there is a statistically significant difference between the two or not. This kind of analysis tells us whether there is some sort of pattern between two groups, if they are similar, if they are different. If they are different, how different are they? But other than that, it doesn't tell us if there is a cause-effect relationship between the groups. It just tells us if they are similar or not. And if they're not similar, that difference, is that significant enough or high enough to be called a causal effect for the outcome? It should be confirmed with a regression analysis. So at this point, what we have is just association in terms of significant difference or similarity between groups. I think for this to make more sense, before we go to the test part, let me show you an article. This is a research on factors that affect the development of symptomatic disease among COVID-19 patients in Ethiopia. It's a case control study. So what we did was we tried to analyze we try to assess which group of patients develop symptomatic disease after getting infected with COVID-19, because some of the patients were, some of the individuals were symptomatic, some of them were symptomatic, and not only symptomatic, but they develop severe or critical disease, while the others stay asymptomatic, even the majority in our setup. So we wanted to know what were the significant factors that were responsible for making the patient symptomatic and develop severe disease when after getting infected with COVID-19. So let me take you to the article and let me show you what we did. So there's a link to the article on the slide. You'll be able to access it later. So I think you can see the slide, right? You can see the article. This is a study on, you can see the article, right? You can inbox me, maybe. Emma, can you see the article? Yes. Okay, thank you. I think just if you're not seeing the string, the screen, please inform me. So this is the published article, and the way we conducted the studies, we started by gathering patients with symptomatic COVID-19 and a comparable state of group of patients, individuals who are not symptomatic. So we started from the outcome, and we tried to assess for their exposure, their other history, their prior medical history, and we tried to see if they have any similarity or difference. And at the end, we tried to make an inference if some of the factors are actually responsible enough to make the patient develop symptomatic disease and develop further severe or critical COVID-19. So since this is a comparative study design, as you can see, this is a comparative study design. So in a comparative study design like case control, our interest is we start by having groups with the exposure, with the outcome and no outcome, and we try to see if they have some significant exposure in the past. So with this type of study design, after doing the descriptive analysis, as you can see here, we're trying to describe our study participants based on their socio-demographic characteristics like age, gender, medical illness conditions, substance use history, and others. So, and their laboratory profiles. So after presenting their descriptive analysis, what we should do is, before proceeding to the regression analysis, since this is a comparative design, we have to do a comparative analysis. That means comparing our cases and controls. The main interest is, if you go back and read study designs, we have explained that these comparative study designs are designed so that they have a comparable group at the beginning. So if you have cases and controls, the assumption is, in an ideal scenario, the assumption is our cases and controls are similar, except their outcome status. So based on all other socio-demographic or disease-related factors, we believe that they're comparable, they're similar enough, except the fact that one has developed symptomatic disease and the other did not develop symptomatic disease. So to confirm whether that's true or not, we have to do comparative analysis, see if there is a significant difference between the two groups, the symptomatic and the asymptomatic groups, in terms of their age, their gender, their history of pre-existing comorbid illness, or in terms of their laboratory profile and vital signs. So we do a group comparison for factors, and we try to see if they have a significant difference. As you can see, there is a p-value here. The p-value can be a p-value of different tests. So the most important thing is not just running the test. Running the test is the easiest part. The most important part here is we have a number of test options. So in comparative analysis, the most important thing is identifying which test to use and in what scenarios. So after we identify that, running the test is easy, and I'll show you how we get these p-values and how we present it. So let's go back to the slide. We will come back to the article later to show you what specific type of analysis method, statistical test that we used. So before proceeding to selecting the tests, the comparative tests for all level of data analysis, we should identify, the most important thing is identifying our variable level of measurement. This is also something that I have talked about almost in every webinar. It's because it's a very important part. So I want you to pay attention. So when we select an appropriate statistical tool for any of the three labels, whether descriptive, comparative, or regression analysis, the most important thing is understanding the scale of measurement of the variable that we are analyzing. If I have, for example, if I have age, and if I want to describe age, first I have to understand the scale of measurement of age so that I can describe age. I have to decide the scale of measurement. If I want to do comparative analysis, the first thing that I start is, how am I going to measure age? Is it in numbers or is it in categories? And the third thing is, if we want to do regression analysis, again, we have to decide how are we going to measure age. So without answering that question, we can't actually conduct any of the statistical analysis steps. So this is a variable type and their scale of measurement. In general, we have two groups of variables, categorical or qualitative, and numeric or quantitative variables. The categorical variables are variables which tend to assume responses that are in categories. So based on the nature of the categories, we can have two types of categorical variables. The first one is nominal. Nominal is just a variable with a number of two or more responses, which doesn't have any natural order. That means responses, one of the responses doesn't have any higher rank or low rank compared to the other. Here, for example, we have gender, male, female. We can't say that female is greater than male or male is greater than female. The same works for religion or other nominal variables. But when sometimes those responses can have a natural order. For example, in a stage of a disease, for example, in malignancy, we have like stages. If we find a patient in stage 2 or stage 3, just because we didn't find the patient earlier doesn't mean that the patient has skipped those stages. The patient definitely had gone through stage 1 and 2 before reaching to stage 3. So if it is mandatory to go through all the stages before reaching to the next stage, that means they have unordered nature, they have a rank, they have order. So this type of variables are called ordinal variables. It's understanding this is, again, very important, especially when we're doing regression analysis. And the other is numeric variables. Our numeric variables can have either discrete nature. That means they might assume only integer values like number of cases or number of patients with hypertension. It will be like 1, 2, 3, 4. You can't have 1.5 patients or something like that. And we call these discrete or count data. But if your numeric variable can assume all values on a continuous scale, like the weight of a patient, serum potassium, sodium, other laboratory values, then that variable is called that variable scale of measurement is on a continuous scale. So understanding these things, identifying what scale of measurement your variable has, or what scale of measurement that you prefer to use for your variable has to be defined before initiating your data analysis stage. For example, for age, we can ask, we can keep the original data where we have asked our patients how old are they. We just collect the data, right? Like 54, 72, stuff like that. But we usually, when it comes to analysis, to give it a more clinical meaning, we categorize our variables into like 50 to 59, 60 to 69. So by doing that, I have completely changed the scale of measurement from a numeric scale or the scale into a categorical variable. So it's up to us. We can manipulate our variables in a reasonable way so that they can give us a better meaning in the context of our research question. So when we do that, we have to decide that before the analysis so that we can use the proper statistical tests to summarize or compare our data. So this is a very important part I want you to pay attention to, and most of the session is going to be practice so that I can make sure you have grasped the main part. So when we select, we have different options of comparative tests. When we select a test, there are steps that we should go through. The first step is identifying the variable scale of measurement, like the way we discussed now. So if you remember on the article that I showed you, we have tried to compare asymptomatic and symptomatic group of patients based on their age, their gender, prior history of medical condition, their substance use history, and their laboratory values. So when we try to compare these two groups, we are trying to compare them with a different combination of variables. So based on the variable nature, we can have different combination of variables. So when we're comparing two groups, they can have this sort of combination. For example, both of the variables that we're trying to compare can be categorical. For example, in our example, the article that I just showed you, we have symptom group. We have symptom group, which is classified as asymptomatic and symptomatic. And on the other hand, we have age group, which is classified as into groups like 40 to 49, stuff like that. So both of these are categories. So we can have either both categorical variables, both variables that we're trying to compare can be purely categorical, or we can have a different sort of combination based on the two groups scale of measurement. We can have different combination, either both of them are categorical or both of them are numeric, or we can have a numeric variable combined with a categorical variable with different level of responses and with different degree of pairing. We'll see them one by one with an example. So before proceeding to the tests, let me show you something. The second step is after identifying what's the scale of measurement of the variables that I'm trying to compare. Are they categorical, are they numeric, or is it a combination of numeric with categorical? And if it is that, which type is it? We have to identify that. After going through this process, the second thing to do is we have to select the test to compare the two variables. So basically, we have two types of tests. The first one is a parametric test, and the second one is a non-parametric test. These tests are very important. I'm sure you have heard of them. I just started with their names, with the description of the tests. Might seem confusing, but when we go to the test, it will be easy. So parametric tests are tests which make assumptions about our data distribution, the population data distribution. So they usually have their own assumption that should be tested before conducting or running the tests. So we always have to test their assumption. But sometimes our data might have a distribution that is not normal or that doesn't represent the whole population. So we might have some sort of skewed nature data. In that case, instead of using the parametric test, when the assumptions fail, we jump to using the non-parametric test. So each of these variable combinations, they have two test options. So if somebody asks what kind of test should I use to compare two categorical variables, you have two options, one parametric, one non-parametric tests. So if you have both tests, which one should we use? The first option is always a parametric test. Why do we a parametric test is always our first option? Because it assumes there is a normal data distribution of the population, and we have to test the assumption and we have to use it. If it fails, we have to use the non-parametric correlate of that parametric test, because these non-parametric tests are tests which don't have assumptions, or we call them distribution-free tests. So why do we start with parametric tests? I mean, I'm sure most people hate testing assumptions of a test, because I usually come across with papers, articles, which do not even run any assumption tests for their parametric tests. And when you ask them, they say it's tedious, or they don't know the assumptions, and many other reasons. So if it is tedious, if it is not interesting to do it, why don't we do non-parametric tests right away without considering the parametric test? Well, the answer is parametric tests have greater statistical power. So this simply means for the same data set, if there is a difference between the data set that we're studying, if there is an actual difference, the ability or the probability of the parametric test to pick that difference is higher than the parallel non-parametric test. So the parametric test will tell us at a larger proportion or likelihood that there is a difference between the variables. So the probability of missing an actual relationship or an actual difference between groups is less as compared to the non-parametric test. So since any researcher's goal is to identify the presence of a significant relationship or a statistically significant difference, then it's important to go for the parametric test all the time, as long as our assumptions are made. If the assumptions are not made, then we have to jump to the non-parametric test. So let's see them one by one. If we have two categorical variables, then we have to use its own group of tests. Let's start with an example. So here, my interest is to see if there is an association between sex and COVID-19 disease severity. As you can see, both of these variables are categorical responses in general. So sex, male, female, I have, and COVID severity, I have 3 groups, mild, moderate, and severe. So both of them are categorical variables. They can have 2 or more responses, but both of them are categorical responses. So the first option is always to use the parametric test, and the proper parametric test that we should use to compare to categorical variables is a chi-square test. So chi-square test has its own assumptions, and after picking the chi-square test with logic, like the way we did now, we have to test the assumptions. After testing the assumptions, if the assumptions pass, then we interpret our data and we contextualize it based on the study setup. But if the test fails due to different reasons, then we have to use the parallel non-parametric test, what we call Fisher's exact test. So here I have tried to put the statistical summary measures that each of these tests give us, and it's a proportion because it's a categorical variable. If you see data analysis part 2, then you will know why proportions are here, and for the numerical, why mean or medians are here. So you can go back and refer that. So this is how I pick. So my first option is chi-square test. If it fails, I go and use the Fisher's exact test. The second combination is a numerical variable with a categorical variable, but this categorical variable has 2 responses. As you can see, it's not just 2 responses. These 2 responses or these 2 groups are independent or unpaired groups. They're not dependent or they're not from the same population. For example, is there association between length of hospital stay, which is measured in numbers, so it's a numerical variable, and hypertension. So we have 2 groups of patients who are hypertensive and non-hypertensive, so it's a categorical variable. No, not only categorical variable, but these 2 groups are completely different groups. They're not same individuals before and after some exposure or before and after taking some medication or treatment. So rather, these are completely different groups, one group with hypertension, another group with no hypertension. So these are 2 independent groups, a categorical variable. Then the proper test to use is an independent or unpaired t-test. And it has its own assumption since it's a parametric test. When it fails, we use the parallel non-parametric test called Mann-Whitney test. So this is how it goes. Since you are going to practice, let me explain it briefly. So this categorical combination for 2 groups, 2 independent groups, might not be always the case. We might have 2 categorical responses groups, but these groups are dependent, like the same group of patients before and after some exposure, or after having being treated with one medication and then shifting to another medication. So we're talking about the same group of patients in different circumstances. So we call that a dependent group, and the responses are 2. So in this case, the example is we're trying to measure BP level, which is measured in number, so a numerical variable, with the type of drug the hypertensive patient is taking. So we have 2 groups, group A on medication X versus the same group A on medication Y. So we have one group taking medication A at one point in time and taking medication Y at a different point in time. So since these 2 groups or these 2 responses are from the same group of patients, it's a paired data with 2 responses. So in this case, our choice of parametric test is a dependent or paired t-test. If the assumption of the test fails, we go and use the Wilcoxon signed rank sum test. By the way, how to run these tests on a spaces, how to test their assumptions, how to interpret the assumption results, how to interpret the results of the tests are with a spaces demonstration available on my group. I can give you the link and you can go there and follow it and you can perform it. Since the most important part is picking the test and not running it, I'm going to focus on picking the proper test for your research. That's why, so don't get confused. All those things are available. I'll give you a link. So the fourth combination of variable that we can get is we can have a numerical variable with a category, but in this case, the number of responses are 3 or more. The number of groups are 3 or more, and these 3 or more groups are independent. It's like the independent t-test, but the groups are 3 and more. So in this case, for the same example, lengths of hospital stay, we have, it's a numerical variable, and we're trying to compare it among COVID-19 severity, among patients on different level of COVID-19 disease severity. So we're trying to compare mild, moderate, and severe. This is a categorical response, and it has 3 responses. Since it is 3, the proper test to use is independent group ANOVA. So this is where ANOVA comes when we have 3 or more groups, which we are trying to compare based on another numerical variable. And ANOVA has its own assumptions. We test the assumptions, and if the assumptions fail, we go and use the Kruskal-Wallis test. And for the ANOVA, just like the independent group ANOVA, we might have 3 or more groups, but these groups could be dependent or paired. The same as pair t-test, but here the groups are 3 and more. So for the same example as the dependent t-test, if we have, if we try to measure BP level among patients, among the same group of patients, like group A, while taking different type of medication, like X, Y, and Z, the same patient taking different medications at different points in time. So since there are 3 groups, we have to use ANOVA, but since the groups are the same group of patients, it's a paired data, so we have to use repeated group ANOVA. So after picking repeated group ANOVA, we test the assumptions. If the assumptions fail, we use the parallel assumption-free or distribution-free test, the Friedman test. After conducting these things, our last sort of combination, variable combination we can have is both numeric variables. So when we have both numeric variables on a continuous scale, for example, if we try to assess the relationship between age and systolic blood pressure level, and if we measure both, if we decide to analyze them both as a numeric variable rather than other groups, then they are both numeric variables, and the proper test to use is Pearson correlation. So Pearson correlation is a test that we use when we have both continuous numerical variables. Pearson correlation again has assumptions because it's a parametric test. If the assumptions fail, we have to use the Spearman correlation, which is the parallel non-parametric test for the Pearson correlation. So this is how we pick our test. So again, just like I presented this again and again in the previous webinars, the beginning block for all of these is identifying your variables scale of measurement. Sometimes some variables can have their own scale of measurement, and which we don't even want to change. But for other variables like age, we might decide to change their scale of measurement from the original scale of measurement into a different one. So that it can become more convenient for analysis and interpretation. So if I collect the data for age as a numerical variable, but later if I decide to use a categorical response for age, if I want to create groups of age groups, then the proper scale of measurement for analysis is the categorical variable, not the numeric variable, which we have originally used to collect the data. So it's very important to exercise this. You might not memorize it right away, but going back and referring it every time you do, you select your test is very important, because believe me, more than you can imagine, most of the research published articles have a wrong test use, especially people fail to test their assumptions for the parametric tests, and they just, I don't know, without testing the assumptions, they use these parametric tests. Using or running parametric tests for a data which has failed the assumptions will give us a false result and unreliable output. So testing assumptions is always important. If it fails, you shouldn't frustrate, because there is always the option of the non-parametric tests for all of the parametric tests that we can use. So going back to the steps, so identify the variable scale of measurement, select your test, and then test your assumptions for the selected test. If it fails, don't frustrate. There's always a parallel non-parametric test for each and every parametric test that we can use to compare our data set. So this is how you pick your test. I want you to try an exercise so that we can see if you have understood it or if I have to go through it again. This is the first example. Try to see the group of the pair of variables that we're trying to compare, identify their scale of measurement, and tell me the proper test that we should use. After you pick the question, maybe I can go back and display the table. You can write your answer on the chat box. Okay, maybe we can all work on it together. I'll give you another exercise too. So it says, is there association between disease severity at admission, Ilal? And the responses are mild, moderate, and severe. So this is to start with a categorical variable, right? So disease severity is categorical. And the other variable is disease outcome. Again, this outcome is presented as improved versus complicated. So again, it's a categorical response. So what I have is two categorical variables. So when I have two categorical variables, I shouldn't bother about the number of responses in each group. If it is two categorical variables or two numeric variables, there is a straightforward one test. When the combination is numeric with categorical, we might have different choice of tests based on the categorical response and whether the groups are paired or not. So in this case, since we have both categorical variables, most of you have answered it, almost all of you have answered it properly, then the proper test to use is a chi-square test, right? Are we okay with this? Do you have a different opinion? Maybe since I haven't displayed the table, it's possible that you might forget the combinations. It's all right. If we are okay with it, okay, you can, okay, thank you. If you have a different opinion, you can raise your hand or you can type it on the chat box. I'll get to it. So let's go to the second example. Drop your answer on the chat box. When you write ANOVA entities, since they have different types, you have to present that as well, right? They have dependent, independent groups. It's very important because these are completely different tests. You just don't say ANOVA. The type of ANOVA is very important. I literally say, don't say ANOVA, and you guys just keep writing ANOVA. It's all right, though. Yeah, I assume that assumptions are going to be fulfilled, but if the assumptions, the most important thing is to identify the proper parametric test, because if the assumption fails, you know automatically which pair of non-parametric test is suitable for the test. that, and you can jump to it. So here we have blood glucose, which is a numeric variable. And we have different sort of drugs that the patients are taking. And it literally says different group of patients. So we have, this is automatically independent groups. There are different groups and they're taking medication, metformin, glipizide, pioglitazone, and miglitol. And there are 4 groups for categorical variable, independent, and there are 4 groups. So since this is more than 2 groups, 3 or more groups, we should go for ANOVA automatically. So it should be, thank you. Well, yeah, most of you have got it. So this is an independent group, ANOVA. Do you have a different opinion? This is nice. By the way, identifying the tastes is very important and it will be easy. I'm sure by tomorrow you all remember it, remember all the tastes by heart. That's the most important step. So I'm going to give you some time to exercise. Let me attach you the link. And it's very important to practice. The post tests are going to be very comparable to the practice questions that I give. So I always recommend for you to practice it before taking the post test. So please take time, 2-3 minutes, and work on this. You can drop your questions in the meantime so that we can save time for discussion. Please refer to the table. If you finish the first one, you can proceed to the other group of quiz. I just posted the link. Here it is again. I, I just posted another link. Maybe I'll post the other as well. Please try this one in the meantime. I'll give you a couple of minutes. Linku ይሰራል. I don't know how you guys are not accessing it because the other participants are accessing it and answering the questions. Just click on the link and you'll be able to get the questions. So I think since you have the link, the links are available. The links are available on the slides. You'll be able to access it. You can practice later. Maybe there's one more thing that I want to show you. It's the article that I showed you earlier. Let's go back to the article and let's see how to apply it. You can see it, right? It's audible, right? Emma or somebody, you can box.
Yes.
Thank you. Some of them are writing the voice is not heard. And okay. So here you can see there is a p-value. There's a p-value. What we're trying to do is this is a study which try to assess factors that affect the patient's status of becoming whether symptomatic or symptomatic after being infected with COVID-19. So we have a case control study design. Our cases are patients with symptomatic COVID-19. These are the cases. And the controls are patients who were asymptomatic. So these are our controls. We're trying to compare our cases and controls based on different factors, as you can see on the table. All of the tests that we have seen so far, chi-square, t-test, ANOVA, correlation with their non-parametric correlates, all of the tests give us p-values. So by seeing the p-values, we will decide or we will declare if there is a significant difference between the groups or not. So the way we pick that, or the way we decide there is a significant difference or not, is by seeing the statistical cutoff point, which is the p-value. So without that, we can't say if there is a significant difference or not. So it's here on the table, it says just p-value. It doesn't tell us the name of the test. It's not a trend to put the name of the test on. You can see the article, right? It just says, you just shared the screen. I don't know. You can see the article, right?
Yes.
Okay, thank you. So we only have p-values, but we don't know which test we have used. Where we put the name of the test is in a different section, not on the table. So it's assumed that the audience, who is a professional audience, automatically knows what p-value is this test for. For example, here I have compared age with between my cases and controls. So there is a p-value which is 0.0001. So which test do you think we have run to get this p-value? Inbox me. So based on the options that we have, which test did we run to get this p-value? First, let's see the group. So this is a symptom group, right? It's a symptom group. Based on the symptom, we have asymptomatic and symptomatic groups. That means this is a categorical variable. We have age. Age is presented in categories as well. So this is also a categorical variable, right? So we have two categorical variables compared. So what's the proper test? Chi-square test, right? Thank you. So we have used a chi-square test. Thank you. Well, thank you. And thank you. So we have used a chi-square test. As you can see, for all of the tests on the p-values on this table, since the case in the controls or the symptom outcome is a categorical variable, as you can see, all of them are categorical variables here. And the proper test that we should use is for all of them. It's a chi-square test, right? So we have used chi-square tests to compare all of these groups, since they all are categorical variables. So the p-value for this is chi-square test. So as a researcher, you're expected to know what type of test was run to get this p-value. So it should not be strange for you. When we go to the second table, here we have again our outcome, which is cases and controls, two responses. It's a categorical variable. But here we have temperature, heart rate, the vital signs, CBC values, and organ function test with electrolytes. And we have p-values here. So tell me, what is the proper test that was run to get the association or the similarity and difference between the outcome and temperature? We have a p-value here, right? So to get the p-value 0.676, what is the proper test that we should run? These are completely different groups. It's all right, by the way, don't frustrate if this is your first time picking tests. It's something that you get used to through practice, so don't worry. So just go through it slowly. So we have our outcome, which has two responses. So we have a categorical variable with two responses, and we have a numeric variable here. So what we're doing here is actually all of them are numeric variables. We have used the same test for all. It's a numeric variable, and we have one categorical variable, and this categorical variable is with two responses, and these groups are different, right? These groups are different groups. They are different groups. They're not paired. We have some groups who were asymptomatic and a different group of patients were symptomatic. So we have two dependent, different or independent categories, and we have a numerical variable. So the proper test to use is, thank you, an independent t-test. So here, independent t-test is the proper test to run. So we just write the p-value because as researchers and as professional readers, it's expected that the audience automatically knows what kind of test was run and that the assumptions were made. So, but this doesn't mean that we are not going to explain the type of test that we use on our article. So here's the part where we explain the type of tests that we use, the data management and analysis section, a section before the results. Here we present all types of statistical tests that we use for the description, the comparison, and the regression, including their assumption that we're going to measure. Thank you. You guys are doing great, by the way. If this is especially your first time, this is more than excellent. Thank you so much. So here we have wrote that wrote a plan for data summarization or descriptive analysis. We have talked about categorical covariate summarization, about numerical variable summarization using mean and other values appropriately. And here it says that a chi-square test and an independent t-test were run to determine the presence of significant difference between the independent variables and the development of septimill. So statistically significant difference was declared based on a p-value of less than 0.05 This is something that you can learn by going to the group, as I have explained earlier. So the tests that we used are going to be explained here on the data management and analysis section. But when we go to the tables, we're not expected to write the type of test that we used because as a professional readers, it's automatically expected from all of us to identify the tests because like it's assumed that we are researchers and we know these tests. So this is how you pick your test, and we have used chi-square test for this table, and we have used independent test for this table. So I guess this might make the confusion a little better, I hope. So let me take your questions, and if you're comfortable enough to start the post-test, maybe we can go to the post-test. Otherwise, I can post the links on the Telegram again, and you can attempt the quizzes, the practice questions. So you can raise your hand and you can ask. Teddy couldn't join us today. So maybe I don't want to miss any of your questions, so you can drop it on the chat box or you can raise your hand. Someone from EMA can also help me with that. Yeah, the post-test will be, link will be posted by the EMA team. But in the meantime, let's take, I don't know, a few minutes and let's address your concerns. Okay, it might not be just a question, but you can ask whatever you want. I mean, regarding this in terms of its practicality or some other things. If you are working on research, if you have similar concerns, we can discuss on that. Is this confusing or did you understand it? Thank you. Was this new to you or you have a previous exposure of comparative tastes? Please inbox me. Thank you. Can we use different tastes for same study? Yes, Tolera, the one, if I get your question correctly, in the same taste, I mean, in the same article, if we have a different combination of variables, we can use as many tastes as we can, because that's the proper way of using it. But when it comes to regression analysis, for one research question, we're going to use only one regression analysis. But for descriptive and comparative tastes, we have to use the proper tests and the proper data summarization tool for each and every variable combination. So yes, as you can see, for the article that I just showed you, we have used two different types of tests, chi-square and independent test. So I think the answer is yes. Is that what you wanted to ask, or did I get your question? Yes, this is not a regression analysis. For regression analysis, yes, we use a variable selection criteria. It's something that we're going to cover on the next webinar. But in this webinar, it's just a one-to-one association test. And the usual cutoff point is 0.05 p-value, because we tend to use 95% confidence level. So as I said, you can access, let me give you the link to the menu. By going through this link, you can access all the topics on my group, and you can go to the chi-square and all other tests, and you can see how the assumptions are tested, how the tests are run, and how the results are interpreted. And about the what's the advantage of having greater power with parametric test? Having greater power means, I mean, every test is not capable of identifying a true relationship 100% of the time. We call that the power. So we usually settle for a power of 80%, even when we calculate our sample size. 80% power is considered as good enough. But if we have two tests which are different based on their power of identifying the true relationship between two variables, then definitely we go for the test with a greater statistical power of identifying that relationship between the two variables. So greater power means greater ability or greater probability of identifying a true relationship. So if the parametric test is able to identify the true relationship like by 90%, then the non-parametric might identify it by just 80% or 70%. So we definitely want to use the parametric test because it has a higher probability of detecting a true relationship. Does that answer your question, Fikra Mariam? It's all right. About the confusion, I totally understand. It's something that you should practice. With practice, it will become like at the tip of your finger. The link to the article and everything is on the slide. It will be emailed to you. I'll share it with Emma. About the testing the assumptions and everything, as I said, it's on the Telegram group. Yeah, why we use cutoff point of less than 0.5 p, that's also a regression concept. We will cover it on the next webinar. But if you are interested, you can, before that, you can read on the Telegram group. Following the link, you can access the topic menu. There you have a regression. We have a regression options. You can go to the regression chapter and you can read about it. You can also read on data analysis part on my YouTube channel. You can you can watch the video on data analysis part. Yeah, if a non-parametric test doesn't fail, that's the point. What can we do if a non-parametric test fails? The non-parametric test doesn't have assumptions. That's the whole point. Parametric tests have assumptions. When the assumptions fail, we go to the non-parametric assumptions because they are distribution-free, assumption-free tests. That's the whole point. Quasi-experimental design. We're covering the observational design for now, but if you have a very concerning issues regarding that, maybe you can email me. Let me show you the slide and you can access, I think, all of it on it. Any other question? The previous slides and videos can be accessed from the EMA website. I just dropped the PowerPoint from today's session. Here, I think it's loading. You can access that. Any other question? Yeah, you can use that link to get the previous session PowerPoints and videos. Thank you. Prognostic and diagnostic study designs. Prognostic and diagnostic study designs. Could you be more specific? Can you please explain further? Yeah, I mean, study designs are not just based on whether they're prognostic or diagnostic. Rather, the classification of your study design is based on how you would like to approach your study population. Where do you want to start from? Is it from their outcome or from the exposure? Is it a one-time study or a one-stop study, or do you want to have a follow-up study? Those are the criteria, and based on that, your purpose of the study can be either prognostic or diagnostic. Otherwise, just because it's prognostic or diagnostic, it doesn't change the fact that the basic nature of the study design. Does it make sense? Maybe, I don't know. You can inbox me further on Telegram. Maybe I can get to it. Lahun. Any other question? I think let me post the links again, and it would be great if you guys try to attempt the questions again before the post test, because the post test is like almost similar to the practice questions that I post. Please try those questions, I don't know, for 5 minutes, and oh, I'm sorry. Please attempt the question. From Emma's side, do you have anything to say? If not, I mean, you guys can take 5 minutes maybe and attempt the practice questions before going to the post test. That would be good for you guys. I think if you guys don't have any other questions for now, I'm done for today. Thank you very much for attending the webinar. You can access the previous materials from the Emma website. And thank you so much for coming.